Hi, I'm Jag Singh from Heart Rhythm TV. I'm really excited to be here with David Hayes and Ken Nelson. It's so good to see you guys. Really looking forward to what we're going to discuss today. So David and Ken, let me start with you, David. If you both can introduce yourselves and what your roles are at Biotronik, and then after that, if you can kind of really give me an overview of why you're excited about HRX.
Thanks, Jag. So David Hayes, I am currently the Chief Medical Officer for Biotronik. I've been in this role for a little over 2 years. And one of the things that I've watched develop in the company over those 2 years is the focus and interest in digital applications and where we might go. So with HRX coming up at this point in time, I'm really excited about seeing what everyone is doing, getting all of the experts together. I think it's a terrific move on the part of HRS to do this. Obviously, we've seen a lot more in the literature about digital applications and what that means for patient management. So for us, it means, what do we do next with our products? How do we better engage patients? How do we take advantage of implantables and wearables from a digital standpoint? How do we move that into disease management? So our expert on that and in charge of our digital services is Ken Nelson. So I'm going to hand it over to Ken for comments next.
Thanks, Dr. Hayes. Hey, I'm Ken Nelson. I'm the head of digital health diagnostics and monitoring for Biotronik, and honored to even be a part of HRX and to have come to Biotronik about 2 years ago, just under 2 years, to build a division around digital health and diagnostics, and how do you tie that in with remote patient monitoring. It's really an exciting time, and to see that HRS is now dedicating an entire conference to digital health, which we're calling HRX, is just great to see, and great to see this whole evolution in healthcare. So excited to be here.
Fantastic. So I think we all agree that sensor-aided, artificial intelligence, predictive analytics, it delivered in a virtual mode is the future of how we're going to be looking after a lot of our patients. And I know you guys are doing a lot in this realm of the digital arena. I would love to hear what you have on your offerings in the management of AFib or heart failure or any other disease subsets, which I'm sure the audience would love to hear about and look forward to see at HRX.
Well, obviously, we've got a number of things that we do with our implantable loop recorder, and where we go next with that next generation, already planned next several generations, for example. And one of the issues for me as we look at these options, and I'll turn to Ken to answer this, is the sky's really the limit right now. There's so much that we can detect and measure and then display digitally. And with our current home monitoring system, where we have daily transmissions, we can get that information every day on the patient, so you can carefully watch trends. But for me, the question is, where do we go next? And Ken is the one who's in charge of that for us, so I'm going to turn it to him.
Sure. So one of the reasons that I'm excited for HRX is that when I go around the country and talk to physicians and staff and hospital administrators, one of the things that always comes up, one of the topics, is data, and just the deluge of data that's flowing into the practice and into the hospital. And so when you think about this evolution of digital health and remote patient monitoring, now we have all these sensors that are either implanted, injected, or worn via patch format or some other format. And so now we have all this great data coming in. I think the challenge is, how do you manage that data? And how do you create different solutions to better manage this influx of data, so that only actionable data is going to the appropriate caregiver, not all going to the implanter, but to the appropriate caregiver, so that they can take action only on actionable data. So right now we're trying to think through and are developing products that really flow into a digital health ecosystem. So think about monitoring across the entire cardiac care continuum, collecting that data, processing that data, and then only sending the actionable data to the appropriate caregiver. And part of that is to do it effectively. We want to take what we do best as a company at Biotronik and then collaborate with strategic partners who may do other things better than we do, or their core business is different than ours. So there's this convergence of smartphones with remote patient monitoring technology, with wearables, with injectables, with implantables, and how do you effectively create solutions that improve the efficiency of a clinic or a hospital and just don't overwhelm the clinic and the hospital. So I think those are the things that we're working on. And really part of the reason we're so excited about HRX is to get the companies that are involved in cardiac digital health together with the larger phone companies, the Samsungs of the world, the big tech companies, the big data companies, Verily, Apple, Microsoft, together with medical device companies, CMS, the FDA, and how do we work together to solve some of these problems? So we're really excited about San Diego and HRX here in September.
Ken just said getting the appropriate information to the right person. I just saw an announcement come through about a talk at HRX interviewing a patient. And for me, that's exciting because clinically, how do we get the right information? What do patients want? How do we get that digital information to them? And I know that'll be a topic at HRX and one that I'm looking forward to.
Fantastic. And clearly, as you know, I'm excited just listening to you guys. And, you know, as Ken alluded to, you know, data is the new oil. And I think the whole intent of this digital world is to predict and prevent and provide personalized medicine. So very excited for all that you're going to offer, and very excited to see you in San Diego. So until next time, see you at HRX.
Thanks.
Again.
Thanks so much, Dr.
Bye.
Sid.